Hello. Thank you for taking an interest in the Mersey Region Ultrasound Guided Regional Anaesthesia Programme. This programme started in Chester when some of the fellows and I were planning to start a training programme. So this was greatly assisted when the American and European Societies of Regional Anaesthesia jointly published a training recommendations for what you need to know to do it. So what they essentially said was you need to find the key landmarks, so you know what you're looking at, identify nerves or plexus, be able to identify normal anatomy and recognize when it deviates from sort of the classically described, plan a needle approach, maintain aseptic technique, follow the needle under real time. So as you advance towards the target, be able to see the needle at all times. Think about a secondary technique to confirm that you're in the right place. Learn about hydrolocation, so basically watching injected solutions move around your target. And if it isn't moving around your target, make sure you can adjust the needle such that it does move around the target. And also maintain a safe practice as you would with any other regional anaesthetic technique. So to that end, they produced some recommendations. So broadly, they said go to a sort of an accredited CME event, some sort of course, basically. Practice ultrasound scanning yourself and your colleagues. So basically practice away from the patient. Get good at needle insertion. So you need to be able to be good at seeing your needle with the ultrasound beam. Learn from experts, so always try as far as you can to follow experts and learn from them continually, and also use ultrasound when you can do a block anyway. So you can be confident that you're going to do the block, but you can use ultrasound to kind of add to the learning experience. So to that end, they kind of identified 4 key skill areas, if you like, and that's to say, understand how your machine works and how to generate a good image. Learn the importance of scanning and learn how to get a good image from when you're just by manipulating the probe. You need to know what you're looking at in the image, so learn sonoanatomy and look at some of the sort of learn to identify some of the common acoustic artifacts, and learn to see your needle in plane and out of plane, and kind of conduct yourself in a sort of an ergonomic fashion. So now the key thing to all these things, you can get good at every single one of them without having to touch a patient. So what they're suggesting is you can be good at all these things before you start doing it on patients. So in summary, they're saying attend a course, develop a library of resources so you can kind of refer to them again, focus on those 4 skill areas before you start doing it on a patient, and you have the key skills before you start needling. And then further to that, it would probably be ideal to have an expert follow you around for about 6 months, offering advice and guidance as you went. So what we felt was that actually all this can be achievable within a kind of a regionally kind of organised course. So the way the course developed, it began as lunchtime lectures with a practical session, and clearly there's always going to be problems to getting to lectures, so it was repeated, and then the suggestion was made that the lectures were just put online, so one was introduced each week with a practical session about that, and that developed into the online course. So what if you decide to kind of get involved in the course, you'll get sent this. So it's a PDF, which is the sort of an introduction to ultrasound guided regional anaesthesia, and we deliberately called it an introduction because the feeling was that if you can learn the key skills and get good at all the key skills, you can do any block you like, provided you can then go and find the anatomy. So it's only ever an introduction, and it's not the last word in it, but hopefully it will get you up and running and scanning, and then you can develop your practice from there. So in fact, there are 8 sections. The neuraxial blocks is a work in progress. So each of the 8 sections has 4 elements. So there's a short lecture or a short presentation which is hosted on YouTube. There's some additional reading material which you can look at if you want to. There's both reading material and links to other websites. There's questions on the lecture, and that really just serves to reinforce the points that we want to get across. And there's some practical exercises that you can practice by yourself and then discuss with various tutors at each hospital. So we'll just look at section 6 briefly. So section 6, upper limb above the clavicle. The first link is the link to the presentation. So if you click on that one, we'll have a look at it in a second. And then the first 4 of these links are just other kind of accounts of how to do these blocks, and then an article. So if you really want to get into it, you can look at all those things. So this is one of the lectures. More of my droning voice, I'm afraid.
Hello, and welcome again from my kitchen to chapter 6 of our ultrasound guide.
So you get the idea. Slightly amateurish in places, but I think it gets the point across. So then here's some of the practical exercises. Once you've watched the lecture and you've kind of looked at some of the links, you can then practice at any time you choose and just try and achieve all of these practical exercises. And then there's a 5 to 10 questions, the answers to which are all included in the lecture. So there's nothing clever, there's nothing complex. This just really serves to highlight what we hoped you gained from the lecture. Now, the idea of having an expert follow you around for 6 months it clearly isn't attainable, but there's certainly enough enthusiasm and experience within the region that whichever hospital you're at, there will be someone, or in many hospitals, several people who you can approach and say, well, look, I've done this course, or I'm doing this course, can you show me this, or can you show me that? So this is a list of all the hospitals in the region, what regular teaching or courses they offer, and the individuals that you can go to in that hospital to ask advice, or to see if they'll supervise a block, or organise teaching with them. So the other thing we felt was important is to have some sort of logbook. So you can just print it out and carry around with you. The first section is just for yourself to record which lectures you've watched and that you've done the question, and we've linked it to the curriculum codes as well, so you can present this at your RETA to show that this is CPD that you've been doing. So then, similarly with the skills section, there's no skills in the first lecture because it's about physics and stuff. So once you're happy that you've completed all the skills, sign it yourself, and this serves to demonstrate to all the tutors in the hospital where you're up to, what you've done, and they can kind of direct teaching appropriately. And finally, a section about blocks. I think the key to kind of getting good at any sort of skill is focused practice, is kind of repeated learning, but not only learning, but reflection on what you've done, and some sort of feedback. So the idea with this is you keep this block, and when you turn up to and ask a consultant you've never met before and who you've never met before to supervise a block, they can look at your previous 4 blocks, and the comments we hope to get from the tutors is to just highlight the bits you've done well and highlights the bit you need to improve. So you're getting some definite practice, is what the kind of educationalists or deliberate practice what the educationalist would call it. The idea is you build on the experience of your last block. So then you can, when you come to me in Chester and say, can I do this interscalene block, I can look and see you've done 5 before, that you've got good ability to see the needle, but sometimes you have difficulty identifying the structures. So that's what we can work on. So it gives you an indication of what you're learning, and it gives us, the instructors, an indication of where you're up to. So if you have completed all that, then you can contact us, and if you'd like, we can organise a 4-station OSCE, which has got some fairly straightforward tasks. It just allows us to see and to confirm that you are making some progress, and that we can kind of sign you off, if you like, to say yes, you can start practicing on people. So station 2 was some fairly straightforward kneeling tasks. This station is talking about the ergonomics of blocks. So I think it's important to kind of have a think about where you're putting yourself in your machine and your probe, and which way around the probe is. So if you complete all that, we'll give you a certificate. And hopefully the aim would be that before you start doing this on patients, you complete this course, which will then give you a huge step forward in actually kind of doing it in real life. And hopefully it'll be safer, you'll learn faster, and you'll pick up the technique quicker. So if you'd like a copy of this course, please feel free to either email either myself or Daniel Edwards, who will send you the course, the logbook, and the list of tutors in each hospital. So thanks very much for listening, and happy scanning.